Friends, let us discuss on a very important organ of the human body, namely the kidney and the kidney failure. Of course, the symptoms of kidney failure, the causes, the types, the stages that it undergoes before it's a failure, again, the tests, treatment, prevention, etc. Kidneys are a pair of organs located in the lower back. One kidney is on each side of the spine. They filter the blood and remove the toxins from our body. Kidneys send the toxins to the bladder, which our body later removes during urination. So, the kidney failure occurs when kidneys lose the ability to sufficiently filter the waste from the blood. And the factors that can cause the kidney failure are, in general, certain heavy medications, certain acute and chronic diseases, severe dehydration, kidney trauma, that is impact or physical damage to the kidney, the body. So these are some of the important reasons. So the body becomes overloaded with toxins if kidneys cannot do its regular job. So this can lead to the kidney failure, which can be life-threatening if left untreated. And the possible symptoms of kidney failure, the symptoms include a reduced amount of urine, swelling of legs, ankles, and feet resulting from the retention of fluids, unexplained shortness of breath, the excessive drowsiness or fatigue, then the persistent nausea, even confusion, pain or pressure in the chest, coma, etc., are the important symptoms of the kidney failure. And the causes are different. The causes of kidney failure, typically they are a sudden loss of blood flow to the kidneys. That's number one, the basic reason, the important reason, that is sudden loss of blood flow to the kidneys. And this can happen, that is a sudden stoppage of blood flow to the kidney. It can happen for reasons like even heart attack, heart diseases, the liver problem or liver failure, dehydration, due to severe burns, allergic reactions, severe infection, high BP, and anti-inflammatory medications. So they can all limit the blood flow leading to the kidney failure. And the second reason is the urine elimination problem. Say whenever body cannot eliminate the urine, toxins build up and overload the kidneys. Some cancers can block the urine passageways. So the reasons for blocking the urine passage, they are the cancer of the prostate gland, most common type in men, and even the cancer of the colon, the cervical bladder, and also it can be due to kidney stones, an enlarged prostate gland, blood clots within the urinary tract, and damage to our nerves that control our bladder. So these are the other reasons. And there are also other important reasons for the kidney failure, other causes. They are, see, a blood clot in or around our kidney, it can cause the kidney failure. It may be due to infection, again, overload of toxins from the heavy drugs and alcohol, an inflammation of the blood vessels, inflammation of the small blood vessels of the kidneys, and the breakdown of the red blood cells following a bacterial infection, usually at the intestine, cancer of the plasma cells in the bone marrow, also the thrombotic disorder that causes blood clots in small vessels, the chemotherapy drugs also used in the treatment of cancer, it can also cause the It can also one of the causes for the kidney failure. Even dyes used in some imaging tests can cause this. Certain antibiotics can cause this. Uncontrolled diabetes can cause this. So these are all the various causes for the kidney failure. And there are different types of kidney failure, like the acute prerenal kidney failure. That is insufficient blood flow to the kidneys. It can cause this acute prerenal kidney failure. The kidneys cannot filter the toxins from the blood without enough blood flow. So this type of kidney failure can usually be cured once the doctor determines the cause of the decreased blood flow. And number two, the acute intrinsic kidney failure. So it can result from the directed trauma to the kidneys, such as the physical impact or an accident. So causes also include the toxin overload, severe bleeding, shock, renal blood vessel obstruction, etc. And the other type of kidney failure is the chronic intrinsic kidney failure. That is, in this case, this happens when there is a long-term damage to the kidneys due to the intrinsic kidney disease. So it becomes chronic. So intrinsic kidney disease develops from a directed trauma to the kidneys, such as severe bleeding or due to lack of oxygen, resulting in lack of oxygen, etc. And also another type of kidney failure is the chronic post-renal kidney failure. Post-renal. So a long-term blockage of the urinary tract, it prevents urination. So this causes pressure and eventual kidney damage. So there are so many damage tests to diagnose the damages caused to the kidney, resulting in the kidney failure. See, coming to urine, the simple test. If the urine is very foamy, urine with excess bubbles, it's a sign that it has a lot of protein in it. So protein in urine, it is a sign of kidney disease. And again, urine analysis is done for finding out the kidney failure. Abnormal protein or sugar that spills into the urine, it is we find out that in the urine analysis, it can be a reason for kidney failure. And then we also perform a urinary sediment examination. So this test measures the amount of red and white blood cells. And this test looks for high levels of bacteria and such as for high numbers of the tube-shaped particles called the cellular casts. The urine volume measurements, that's also another test. Here, measuring urine output is one of the simplest tests to help diagnose the kidney failure. For example, the low urinary output, it may suggest that kidney disease is due to urinary blockage. It may be due to multiple illnesses or injuries. And even blood samples are also they are tested for kidney failure. The blood tests to measure these substances that are filtered by kidneys, such as the blood urea nitrogen BUN, blood urea nitrogen, and even the creatinine. So a rapid rise in these levels, it may indicate acute kidney failure. So blood samples are tested for the percentage of blood urea nitrogen and the creatinine present in the blood. And even imaging tests like ultrasounds, MRIs, and the CT scans, they provide the images of the kidneys themselves as well as the urinary tract. So this allows the doctor to look for the blockages or the abnormalities in the patient's kidneys. And the kidney tissue samples are also taken and they are tested. That is the biopsy test for abnormal deposits or for the infectious organisms present in the blood or urine. So these tests can help determine whether your kidneys are functioning as they should. And kidney also does not file all of a sudden. So they file in different stages. For example, the kidney failure stage 1, it is very mild. The patient may experience no symptoms and have no visible complications, but some damage is present. So it is still possible to manage and manage, and slow the progression by maintaining a healthy lifestyle. So this includes eating a balanced diet, regular exercise, not using the tobacco products, maintaining a healthy weight. So these are all important at this stage. And if you have diabetes, it is important to manage your blood sugar also at this stage. And coming to stage 2 of the kidney failure, even at this stage, I mean, this is also considered a mild form, but detectable issues like protein in the urine or physical damage to the kidneys, they may be more obvious at this stage. And the risk factors that could make the disease progress more rapidly include the heart disease, inflammation, and the blood disorders, which we have to control. And stage 3, at this stage, kidney disease is considered moderate. Kidneys are not working as well as, I mean, as they should. So the symptoms may become more apparent at this stage 3, swelling in the hands and feet, back pain, and frequent urination, etc. The symptoms. Lifestyle approaches may help, so doctor may consider medications to treat the underlying conditions that could speed up the failure. That is to curtail that. And stage 4, kidney disease is considered moderate to severe. So the kidneys are not working well, but you are not in complete kidney failure yet. So symptoms can include the complications like anemia, high BP, bone diseases, etc. So a healthy lifestyle is to be continued, and doctors are likely to have, the treatments designed to slow the damage. And coming to the stage 5, the final stage, the kidneys are nearing or they are in complete failure. So symptoms of the loss of kidney function will be evident. So these include vomiting, nausea, trouble breathing, itchy skin, and more. So these are the symptoms of the stage 5. So at this stage, you will need regular dialysis or a kidney transplant. There are several treatments for the kidney failure. The type of treatment that a patient needs, that depends on the reason for the kidney failure. And dialysis, so dialysis filters and purifies the blood using a machine. So this is a machine. This performs the function of the kidney, and depending on the type of dialysis, you may be connected to a large machine or a portable catheter bag, etc. And the patient may need to follow a low potassium, low salt diet along with dialysis. Dialysis does not really cure the kidney failure, but it can extend the life. I mean, if the patient goes to regularly scheduled treatments. And the another treatment is the kidney transplant. Another treatment option is this kidney transplant. So a transplanted kidney, it can work normally and dialysis is no longer needed. But there is usually a long wait to receive a donor kidney that is compatible with the patient's body. And if the patient has a living donor, the process may go more quickly. And the patient must take the immunosuppressive drugs. Immunosuppressive drugs after the surgery to prevent the body from rejecting the new kidney. This is more important. And these drugs, they have their own side effects, and some of which are very serious. So that way transplantation also is very difficult, complex process. So transplant surgery, it might not be the right treatment option for everyone. It's also possible that the surgery be unsuccessful. Most of the cases it will be unsuccessful also. So the patient has to, talk with the doctor about, whether there is a good candidate for a kidney transplant, etc., and decide. So coming to the diet, limit the sodium and potassium. Keep track of how much the patient is taking in of these two nutrients. Aim to eat fewer than, say, 2000 mg per day of both the potassium and sodium. and the patient has to limit the phosphorus like sodium and potassium. It is good to keep a cap on the amount of phosphorus that he eats in a day. So try to keep it below 1000 mg milligrams. And in the early and moderate kidney disease, he has to also cut back on the protein consumption. Say diabetes is the most common cause of kidney failure. Uncontrolled high blood sugar, it can damage the kidneys. The damage can become worse over time. So managing the blood sugar and blood pressure so they can help reduce the damage. So taking medicines prescribed by the doctor is very, very important. And the regular screenings required to monitor for the kidney failure also is very, very important. And the risk for diabetic nephropathy, it increases the longer the patient lives with this condition. So he has to find out what other factors may increase his risk for this type of kidney disease. And once the patient reaches the end stage, that is the kidney failure stage, so he needs a dialysis to live. Missing even one treatment can decrease his life expectancy. And kidney transplant also is likely to last only for a limited number of years. And if it fails again, it is possible to get a second transplant after the first transplant fails. And the most important reason for the kidney failure is the alcohol. If you have kidney failure and drink alcohol, your kidneys will be forced to work harder than they already are. And certain liquors contain large amounts of phosphorus. It can cause severe heart issues and even death if the kidneys are unable to filter it out. And drinking alcohol with kidney failure, it can hurt the normal function of the other organs also. So over a period of time, heavy alcohol use, it can lead to the liver disease also. So proper treatment and healthy lifestyle changes, they may be able to improve the outlook of the patient. So eating a healthy diet, cutting back on the kidney damaging foods, and treating any underlying issues, it can help extend the health and the lifespan of the patients. So thank you, friends. Thank you. Let us close at this stage.